Plastic surgery and its interventions over a 30-year period in Simon Cowell. We're going to look at some transitional pictures over the last 30 years. Welcome to Talking with Docs. I'm Dr. Brad Wiener.
And I'm Dr. Paul Zalzo.
And I'm Dr. Lauren Willoughby.
So today we have a plastic surgeon who's done some other videos with us. We're going to get her opinion on kind of what went well, what went wrong in plastic surgery for Simon Cowell, someone very famous from America's Got Talent. He does a great job on that show. I love all the little stories where he brings people out that you think may not have any skills, and then they just blow you away.
He's a super good-looking guy, too.
Good-looking guy.
And he tells it how it is.
Yes,
Always entertaining.
Yeah, but he has a soft heart. Like despite the kind of that gruff outer exterior, he can be a bit of a softie with some of the guests for sure.
I'd like to have a beer with him one day.
Yeah, absolutely. Okay, so starting in 1994, we're gonna go through a series of pictures and just look at it as it goes. You'll get to see the pictures that we're looking at. Okay, so 1994 kind of looks like Harry Potter's older brother. He's got the Harry Potter's going.
Oh, okay. Because I was going to say Harry Potter didn't have an older brother.
No, of course you would know that. Okay, so there's 2001.
It's quite a year gap.
Yeah, so 7 years.
Yeah, so he's displaying some typical signs of facial aging, I would say. He's got some frown lines between his brows and some crow's feet, but good-looking guy,
yeah, aging
normal
well.
Facial features.
I'm jealous of his hair.
Yeah, he's got good hair. Okay, here he is in 2002, so 1 year later. He definitely looks younger than 2001.
Yeah.
That's the tan.
So he's still got some crow's feet, so I like that. I mean, crow's feet I think are attractive because it's just a sign of facial expression and animating your face, but these look still pretty similar, I would say. He's smiling bigger in the lower picture, so it's hard to know if he's got cheek fillers or something like that.
Okay. Okay, as we continue on.
So that was 2002.
Here's 2003.
Wow, he looks amazing there.
Yeah, I feel like he's had some Botox in his frown line because those creases are much more subtle. And maybe he's got some Botox in his crow's feet as well. They're a bit more subtle, but still pretty natural, good-looking face.
For sure. Here he is here.
2002.
That's season 5.
Yeah, his cheeks look heavier. So I wonder if he's gotten some cheek filler here.
Okay.
So this is 2005. Let's just scroll back to the other one where he's smiling like that again. So yeah, I think he's got some cheek filler. And I'm looking at his crow's feet here versus here. So I think he's had some Botox for the upper part of his crow's feet, but.
And the filler, just because as we age, we lose volume in our face typically.
Correct.
Yeah.
Yeah.
His hair just keeps getting better.
He's got good hair. Okay, so here we are in 2006.
Yeah.
I think he might have had teeth whitening.
I'm jealous.
Yeah. Yeah, more Botox. Like, so it's got very smooth. It looks good though. Very smooth.
So how many years
forehead.
have we spanned so far?
8.
8?
No, yeah, no, sorry, 12.
12 years.
1994 to 2006.
Man.
Yeah.
And he's pretty fit. I think that's
Yeah,
also
look at him.
what helps
Yeah.
people age well is if you keep the same body weight and stay lean. Okay, that's interesting. So this is 2010.
Yeah. I think so his brow position looks lower to me. So
I agree. His eyes got smaller.
well, I think it's Botox when you get close to the brow and the
okay.
brow drops a little bit. That's a very smooth forehead. It looks good,
Sure.
but
Is
generally
that on purpose
doesn't.
to drop the brow? No.
I don't
Not
think so.
Okay.
It depends, because if you just Botox one part of the forehead and you don't do the other, then you'll get creases in some areas and not the others.
Okay.
But I suspect there's some Botox closer to the brow, which has
Okay.
dropped it. And his crow's feet just look better and better. So
Yeah.
that's just,
Yeah.
Guy looks good. Here we go. Oh, we went back to those glasses from 1994. So 20 years later, same glasses. Okay,
Yeah.
what do you see here?
same sort of thing. Very smooth forehead, Botox. He's maybe had some fillers.
Does he have some symmetry around his mouth now? Does it look a little bit different?
Let's see.
He's got the same shirt. How many years apart are we?
It's a good, and same jacket. I think that's his standard look.
Yeah.
But see how the distance between his nose and his upper lip, it almost looks like, you know, someone had a mustache for 20 years and then they shave it and then their lip looks different.
Yeah,
Oh,
I don't think
Jesus.
he's had filler in his lips
Okay.
or
As
anything.
November approaches.
Yeah.
He's got more jowling, which is a normal feature of facial aging.
How
as
old
well.
is he now around here?
I don't know.
God, he looks
They should
20.
have his age at the side.
Yeah, they should. Okay, so that's 2014. Okay, and here we are.
Yeah.
This is 2016.
Yeah, he looks different, doesn't he?
Sure, with a gray beard. Sure, that
But his mid face has changed.
like
So
fuller.
it looks fuller.
I'd
So
agree with
that's-
you. And he doesn't look
that's
heavier.
filler.
It's not like he gained weight in his face. I think. Okay, so
You're
let's
right. Yeah, you're right. So I think it's filler or probably fat grafting to his cheeks.
Go. Right, so one of the fillers can be fat, right, as opposed
Correct.
to just hyaluronic
Yep.
acid or
Yep.
some of the other products.
We should do
Yeah.
another video on fillers.
We definitely are going to do a video on filler. Okay, so here he is in 2017.
So wait, what was the difference there? Oh, just 1 year.
1 year.
Yeah, I mean, I love the guy, but I think he's starting to look a little bit unnatural
Okay.
Oh,
in his
okay.
mid-face. It's just
Too
lots
much?
of filler. Well, I think too, when you do a lot of filler and you have Botox, when you smile, sometimes your face, it just doesn't look natural.
Right.
Like,
Sure.
it doesn't animate
Right.
the same.
Normal.
Another thing that can make a face look funny, and you're like, it looks funny, but I don't know why. It can be because the different thirds of the face are almost aging at different rates.
Sure.
Like if you do some Botox for your forehead and the forehead looks young, but then
Mm-hmm.
that doesn't match the cheeks and that doesn't match the mouth,
Right.
then it just looks funny.
Okay, that makes sense.
You got a generation face.
That's right. Oh wow. Okay, so this is 2 years later. This is 2018. He definitely looks very different here.
He does. And it's
He's
not
showing
just the shirt.
He's showing a lot of chest here.
That
I think it's the same
same
shirt. It's just way more
same
open.
sh-
But his
tighter
face,
now.
His mid-face
face
looks
really
swollen.
good. Yeah.
It looks swollen. Some of it could be the angle. No one likes that upper angle.
Yeah, yeah.
Not flattering to anyone.
Yeah,
I
Hamza,
don't
can you
think
raise
it's
the
the
camera?
I don't
Raise the
think it's the
camera.
angle though.
It doesn't look natural.
He almost doesn't look like himself there. Like he's been
Yeah,
pretty
it looks like a
consistent over
different
the last
guy.
kind of whatever years.
Yeah.
He
of
looks
pictures.
ripped though.
It's just,
Yeah,
it's
he's
just
fit.
fuller here.
Okay,
I gotta hit the gym more.
that's 2018. Oh, see now look at here. So that's 1 year later.
Yeah.
Got his teeth whitened again. His
Yeah.
eyes look very different in this picture though.
I think his brow has dropped more, probably with some more Botox. It's just, it's kind of, yeah. So when you do quite a bit of Botox here, it drops the brow. So that's why some people will say before you do a lot of Botox for a brow, you have to assess if it contributes to the eyelid opening.
Okay.
Because as we age, you can get hooding on top of your eyelids. And then in some people, when they open their eye, they're actually activating their frontalis muscle to open their
Oh,
eye.
wow.
And if you do too much Botox, the brow drops and then the upper eyelid looks heavy. So I think that is possibly what's going on here.
So you mean if you have to use your thumbs to open your eyes, you've gone too far?
Okay. Oh, okay. So this is 2021. He's looking a little more like himself, I'd
I
say, in
agree.
2021.
I agree. So
Still got
let's
that same
kinda
shirt,
see
Paul.
what-
Still got
Right?
good hair. He's wearing
Hey,
a
if
flat
some-
top there.
If something works, you stick with it.
Yeah.
Exactly. His eyes look a little bit better there.
Yeah. Interesting.
I think with the 2019 photo, it just looks so different because he's smiling with his mouth, but his eyes, I don't know, they're trying to smile, but they're not animating to
His
the
eyes
same
aren't
degree.
smiling.
Yeah, he looks better there. Could be the expression, less Botox. His cheeks look less full,
Yeah.
softer, more natural. So I like that look quite a lot.
Yeah. Okay. And then this is the third last picture. So this is 2022.
Yeah, I think we're running into the same problem that we did 2 pictures ago. With
Right.
just his,
The mid-face.
Yeah, and his lateral brow is just kind of descending and falling in.
Yeah. And obviously, it's very difficult being in the public eye, right?
Oh,
People are
really?
taking
Totally.
pictures of you all the time.
Yeah.
You could take 100 pictures of him over a period of 3 months, and
Yeah.
they would all look very, very different. So
Yeah.
Yeah.
he certainly gets some grace from me. Okay, that's 2022. And the beard, too, changes the perspective a little bit. Oh, okay. So this is later that same year. Looks like you have like a wisdom tooth extraction.
He looks sad there.
Yeah,
Like, I mean, emotionally.
yeah.
Yeah.
I just think, yeah, it's to me the one theme that I'm seeing is just lack of movement in the upper face.
Right.
So like when we smile, normally our eyes crease a little bit, and you get some movement of the brow, and things just look pretty static, and I think that's why it looks a little bit
I
unnatural.
think too, for anyone in the public eye too, you're probably chasing the dragon's tail a little bit. Like you not only want what you had last time, but you want what we had 20 years
Yeah.
ago, or
Totally.
30 years ago, and it's just
Yeah.
not a realistic goal.
Yeah, exactly.
And that must be hard as a physician to kind of counsel someone. Listen, I respect your goals, but it's not attainable. And some people maybe don't tell people that that's not attainable. So here's the last one, and despite his kind of facial expression that he's making, I think he looks better in this picture than he did in some of the other pictures that were earlier.
Yeah.
What do you see?
My eye goes to the brow asymmetry.
Oh, yeah.
So he's got more creases on his right side of the
Yes.
face. So, I mean, that we know he's had Botox.
Sure.
Now we for sure know.
For sure,
Yeah.
no. Yeah.
Not that there's anything wrong with that. Lots of
Still
people do.
super fit, aging well, and I
Yeah.
think for me that's the take-home message from like a series of pictures like this and everything that we see in social media. You know, do your best to age gracefully.
Yeah.
I think there's nothing wrong with doing this stuff. If that's what makes
Yeah.
you feel better and gives you self-confidence and allows you to live your life better, then I think go for it. Just be careful. Don't hurt yourself. Do it with someone that's reputable so that you can avoid the complications and the risks.
I think we got to take it easy on these celebrities that do have
exactly.
too much.
100%.
And don't judge people for their decisions.
My God.
I think even not celebrities. I think people are judgy. Just because you don't get it doesn't mean it's not right for someone else. So you know what?
But, I mean,
Until
often you'll see a celebrity and you're like, oh my God, they've had so much of that. And you're like, you know what? That's their job. They're in front of a camera all the
the
time.
director's saying, listen, you need to do this, you need to do that. So I agree with you. And I think he's awesome. I love his character. I'm sure actually that he's a great guy. We just did this more to highlight what can happen over a period of 30 years of doing stuff like this. So something to think about.
Yeah.
Please leave a comment. Let us know what you think about this or anything of that effect. If you like this video, please like, subscribe to our channel.
And also, if you want to get any more of this type of video, you can go to Dr. Willoughby's website, her YouTube channel. We'll put a link in. Follow her stuff. It's so much more interesting than the stuff we talk about.
Hey, thanks for sharing your expertise. That's super interesting. Your perspective when you see different stuff obviously than we see. If he was standing up, we'd say, hey, he looks a little bit bow-legged, or he's got a limp, or whatever. So.
Yeah, and leave some comments too. Like if you are struggling with your own aging process and you're like, should I do something? Shouldn't I do something? Throw some comments in. People reply all the time, and people help each other a lot on our comment section of our channel.
All right.
And remember, you are in charge of your own health.
We'll see you next time.